Hey everyone, this is Jeff, one of the surgical residents from Southpaws. We had an interesting case today that I thought I'd run you guys through with the CT scan here. We're looking at a transverse view of a 10-year-old border collie that presented to us for a kind of swelling around the larynx and a history of dysphagia and reverse sneezing over the last 6 weeks. It presented to go to CT scan, as you can see, and we have it on its back. It might be a little bit easier if I'll flip it around for you all. So we're starting just in the cranial regions of the sort of neck. We can see up here the frontal sinuses, the little bit of the ethmoid bone there at the ramus of the mandibles, and we're going to work our way caudally, going sort of through transversely. And what we'll look for is, once we come through the larynx, we're going to start to see a mass arising. This is a post-contrast scan, I should say. We can already see bits and pieces of it. It might be a little bit hard to see on the video, but in this region just here, which is that little bit dorsal to the larynx, which the cartilages are going to be these bright parts just sitting there and there. We've got the ET tube in the middle. This is where we're looking for this mass that we're seeing and feeling on presentation. You can see it on the left side. Predominantly it's pushing away this parotid salivary gland, which is this more hyperintense region we can see here. So all of this region just coming up through here is the mass in question. So given the location, and looks more so all of this area just here, and again on this side coming further caudally to where we can see the thyroid cartilage wrapping its way up and around. Given the location, we suspect that this is going to be a thyroid carcinoma, being bilateral as well. As we come further caudally, we can see the cervical spine come through. We then can see these very large lymph nodes start to come up in the prescapular region. That's on the right side, and also on the left side just here. So again, this starts to build up our diagnosis of a metastatic process, or a malignant process I should say. And then if we continue further caudal, we'll start to see our lungs coming into view, and I'll just switch the windowing over to a lung window. And as we come through the lungs, we're going to see some other lesions, nodular lesions, that are suggestive of pulmonary metastasis. I'll just switch it into a thicker slice view, because that makes the blood vessels show up a little bit easier, and you can differentiate the nodules as we go through. So we've already seen our first one that's popping up just here at my fingertip. And you'll notice the difference how they look compared to the blood vessels going through the lungs. So again, there's another just on the right side of the thorax here. And unfortunately for this dog, it does have quite a number of pulmonary nodules. More so in the cranial fields. There's another larger one that's sitting just here. And we can tell they're not blood vessels. If I move back and forth, it's popping up and disappearing, whereas those blood vessels you can see coursing through and following a path as they go through the lung parenchyma. And we come a little bit caudally, and you can still see those little nodules popping up and going away. So we have sent away some FNAs of the lymph nodes and the original mass as well. We suspect that this is going to be something nasty and likely a carcinoma. But we'll just have to wait for results to come back, and we'll go from there. Hope you enjoy this, and let us know if you would like some follow-up on this case, and we'll see what we can do.